So I think we need to be thinking about not just this winter, but an 18-month period. But the truth is, the country is still in, and will be for a long time, in recovery. We've still got 500 deaths a week from COVID, and I would be worried about staff and about staff morale. There will be problems. Some can be anticipated, some will be hard to anticipate.
Would more money now make a difference, or is it actually a bit too late?
I'm sure there will be areas where it will be useful to have money, but one of the biggest areas, of course, is recruiting staff. And if the staff aren't there, more money to recruit them won't help. I think there's a big problem likely to be there around care, a lack of staff there. It may be possible to make some short-term moves to get more people in there with money. I do think a little bit of priming money in the community would be helpful for the sort of things that I'm talking about, but well-targeted money.
In the medium term, over the next, 3 years, come April, the government has promised another £36 billion through the hike in national insurance. Much of that will go to the NHS. I mean, presumably that will make a significant difference.
I'm sure it is, but we've got to see change happening. It's not about prevention as such, it's actually also about creating health and providing the environment for people to be healthier. They're not so much about funding, they're actually about changing the services that are being delivered. And I think that's where one's got to start and then think about funding.
It sounds as if after, 6 years at the top of the tree at the beginning of this century, you've had some time to think about how services are provided, and you think perhaps we've got it wrong at the moment.
Yes, we made a big change at the beginning of the century by really focusing on priorities, and things like waiting lists and so on fell. And I think I would argue, wouldn't I, that was right at that time. But there were two things we didn't do, and I've worked in Africa pro bono for the last few years, and the areas I always thought we didn't get right and we need to get right now are this focus on health. But the other area that I think we didn't do as much as we could have done was to change staff roles. So we did introduce nurse prescribing, we did introduce nurse consultants and a range of things like that. But I think we can be much more radical. And we sometimes get trapped into just thinking that health is about the NHS and about healthcare. And we need to make sure that we sometimes take off our NHS glasses, as I would put it, and think about it differently.
Nigel Crisp, who was the Chief Executive of NHS England between 2000 and 2006. There's often an hour or so before a